BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
Hi, this is Devin Lockett, the president of JobSite Route. As the son of a general contractor, I know how difficult it can be to get good food on the job site. And letting your construction workers leave the job site to buy lunch just takes valuable time away from them being on the site. I've developed an app and a program that will bring a steady stream of food trucks to your job sites every month for the low price of only $100 per month per site. That comes up to about $3 per day to have a steady stream of food trucks coming to your job sites all day, every working day. You can also contact the food trucks ahead of time and pre-order your food from the menu on our app. This saves valuable time for your construction workers and for you. It also sends a variety of delicious food served on Southern California food trucks to your job sites all day. When you think about it, it only makes sense to join the JobSite Route Network. Hello, good afternoon. Hi, happy Monday. I hope everyone has had a great weekend. Hope everyone's enjoying themselves, and hope everyone's having hope this is the beginning of a very productive week. We're winding down toward the end of the summer. It's been a great summer, and so now we're here
to talk about human immunodeficiency virus, or HIV. HIV, right? First of all, I want to put this disclaimer out here. I am not a doctor and nothing, excuse me, 1 minute. And I am not a doctor, and nothing that you see on BiomedRx TV should be construed as medical advice or prescription or diagnosis or anything. However, I will give you ways that you can use magnets, permanent magnets, to help you in the process of ridding your body of pathogens. Pathogens meaning viri, bacteria, fungi, and parasites, as well as heavy metal toxin burdens. A lot of things can be cured or at least assisted. The process of curing can be assisted by the use of biomagnetic pair therapy. Biomagnetic pair therapy is a technique that has been developed by Dr. Isaac Goiz Duran, the late Dr. Isaac Goiz Duran, who just passed away very recently, a Mexican physician and scientist. And we've got a number of different areas of the body that we can apply magnets in order to assist the body's own immune system and detoxification mechanisms. Okay? If you put the positive pole of a magnet in an area of the body, you can cause tension, increase tension, and decrease the potential of hydration, the pH. And if you put the negative pole of a magnet on an area of the body, you can increase circulation and relaxation. If you do this simultaneously in areas where there may be pockets of acidity or pockets of alkalinity, due to the presence of viri or bacteria or fungi or parasites or heavy metal toxin burdens or any other type of toxin, then we can assist the body in ridding itself of both toxins simultaneously. Now, before I get into the pairs of biomagnetic pairs that we use to assist us in helping your medication treatment and the other treatments that you are undergoing to deal with HIV, I'm going to give you some words of caution. Biomagnetic pair therapy does dehydrate the body. Before you undergo biomagnetic pair therapy, you should drink a large amount of water, more water than you usually drink. You should be extremely hydrated, and the practitioner should be very, very well hydrated as well in order for this to work. Biomagnetism returns your red blood cells to their proper charge and unsticks them from each other, thus freeing up your blood circulation and freeing up the white blood cells to do their job and to go through the body and get rid of your pathogens and to grow to the proper size, which is about 3 times the size of your red blood cells. So when we are applying magnets to deal with biomagnetic pair therapy, we apply the negative magnet first, as you know, and you do a muscle testing. I've taught you guys how to do the muscle testing. After you do the negative magnet, after you place the negative magnet where it goes, you place the positive magnet where it goes. Now, when you place the negative magnet, you do a muscle testing and you find out if the body is responding, if the right leg seems to be shortening compared to the left leg. And that's kind of an affirmative that you're dealing with a pathogen. And then by having it return to normal or to closer to normal after the positive magnet has been placed, then that's an indication that you have effectively found a biomagnetic pair and you have effectively addressed it. The main magnets that you're going to be applying in the case of human immunodeficiency virus or HIV, before I get into these pairs, I'm going to explain this to you, are going to be thymus, rectum. thymus rectum. Why? Because the thymus gland is a repository for E. coli bacteria, and therefore has a chance of being highly basic or very alkaline. The rectum is a repository for a lot of viri, especially human immunodeficiency virus, and therefore is going to be very acidic. It's very, very low in pH. And so therefore a very powerful, and I'm going to show you the most powerful magnets I have, a very powerful magnet must be applied in both of these locations. The rest of these locations that I'm showing you are going to be auxiliary locations that can be addressed, yes, with strong magnets, with neodymium magnets, but not with the big whoppers that I'm going to use on thymus rectum. Okay, so now we're going to go to the next slide. All right, so here we are. Okay. I'm going to get more clear in my view here. Adductor to adductor. I hope you guys can see that clearly. It's the top pair, adductor to adductor. Okay, I'm going to be moving my mouse around the pair in case you can't see this darker outline around the pair that we're actually looking at. Okay. Appendix to the thymus. Remember the thymus gland, right? But this says put a negative on the thymus. I'm going to use a big, large positive at the thymus. Renal capsule to the right kidney. Liver to the right kidney. Liver to the left kidney. Now you have to remember these pairs because some of them are going to be redundant, and so you want to apply the magnets as efficiently as possible. Hypophysis, hypophysis, the forehead to the forehead. Negative and positive, negative being in the superior location. Index finger to the index. Hepatic ligament to the right kidney. You guys know the way I treat the kidneys. The beginning, the end of the sternum to the end of the sternum. Pardon my translation. You can correct my translation in the comments below if you want, but have a little super chat attached to it. Mediastino to the iris. You see the eye. The inguinal nerve to the inguinal nerve. You can see right there on the sides. Parietal to parietal. Negative on the right-hand side, the patient's right-hand side of his parietal lobe. Right kidney to the capsule of the kidney on the left. And if you remember, we already got this pair, but in reverse. So we're going to be treating both kidneys and both renal capsules. Right here again, superior to the kidney, inferior to the kidney. the left kidney and the capsule, renal capsule on the left side. As you see, this continues to replay itself. Now, this is exactly the way I always place magnets with reference to the kidneys. If you see right here, the negative is directly on the kidney or just a little bit lateral of the kidney, and the positive is above or superior, closer to the patient's head, superior to the kidney, which is going to excite the adrenal glands. Vesicular to vesicular. This is further treatment of the liver. Liver is very important in treating human immunodeficiency virus. Suprahepatico, suprahepatico. As you can see, this is above the liver, negative and positive. Thymus to the liver. Thymus with a positive, liver with a negative. Thymus to the suprarenales, above the kidneys. This is, of course, redundant, but that's fine. Thymus to thymus. Negative superior, positive inferior. Thymus to the rectum. Thymus with the positive and the rectum with the negative. Thyroid to thyroid, either side of the thyroid gland, and I already have magnets attached to each other for this. Troca menor, troca menor. This is right above where the other magnets are for the adductors. Abductors, I'm sorry. Vesicula, riñón derecho. More attention to the liver. Vesicula to vesicula. More attention to the liver. HIV with hepatitis is addressed mediasternal to the mediasternal inferior, above the sternum, negative, and below the sternum, positive. HIV with the erased of memory, and back again to this repeated index to index. This is a redundant. We've already seen that. Okay. HIV in adults. Clitoris and anus, or in the front of the penis, negative, and anus, positive. Rib to rib, negative to positive. Now, we're not going to be able to apply all of these magnets, of course, during the practicum, but you guys have to have a chance to see Kai. The tail of the femur and the heel. You can see the tail of the femur, or the neck of the femur and the heel. Diaphragm to diaphragm. Esophagus to the dorsal spine number 2. The pylor to the urethra. The urethra to the ureters. and the portal vein, the vein to your liver, and your Achilles. Now, I'm not going to go into false HIV because that takes us a little bit too far, and I'm not even going to get into the whole false diagnosis thing. A lot of the pairs are redundant, but you can see here HIV without symptoms, thymus to rectum. Thymus to rectum. That's the one I want you to really concentrate on, because if we can catch HIV early enough, you can actually, well, I'm not going to make any claims here on this channel. I don't want any strikes. But let's just say you want to catch it early. All right. So without further ado, we're going to go to the biomagnetism studio and spend some time with my son Kai Kai. And I'm going to show you guys where to put these magnets with HIV. Ready? Kai? Ready? All right, here comes Kai.
Yep. What's up, everyone?
You drank water, right?
I sure did.
So how you feeling today, son?
I'm feeling great.
Great to know. All right, so let's see here. We are going to HIV is VIH in Spanish, of course. All right. Adductor to adductor, negative. Positive. Appendix to the thymus. All right. Remember, we're going to put the large, before we even get into all of this, let me start with the basics here. the large unipolar negative magnet on the navel to release stem cells throughout the whole procedure. And we're going to start with the basic positive on the thymus, pick up your butt, and negative on the rectum. You're getting in good shape, man.
Yeah.
You're really shaping up. That's okay, the magnet stick. Oh, but we are also going to treat the appendix. The renal capsule and the right kidney. So, of course, that means it's time for us to treat both kidneys. And when I treat both kidneys, I treat them with both magnets. So we're going to place, lift up one arm, superior to the kidney, and on the kidney. Lift the other arm. Positive, superior to the kidney. Negative, on the kidney. Okay. Liver to the right kidney. So we've already taken care of the right kidney, so we're going to address the liver with both negative and positive. Liver to the kidney, it's redundant. Forehead to forehead. Now we've already got a pair that are already attached. So we're going to use the headband, the long headband, because my son has a big afro.
Yeah.
Negative to positive. Index to index finger. How are we going to keep these magnets on my son's index finger? Right? Let me see your index fingers, son.
Okay.
Point it up.
Okay.
That's right. Right on the tip.
I think there are some flies over
I know, right? They're coming in here.
Yeah.
Because we have the door open.
Yeah.
Get off, Kai. Remember to hit us up on Cash App, $BiomedRx. If you like what we're doing here, if you like what you're learning, and hit us up on Patreon, okay, to become an official student. Patreon.com/BiomedRx TV. All right. Hepatic ligament to the right kidney is redundant. We've already addressed that. The sternum to the sternum. The handle of the sternum. To the handle of the sternum. Negative to positive.
Even superheroes and supermodels need a daily dose of nutrients to help make life more super. BiomedRx Supplements is making it easy to get exactly what you need. From kids to seniors, they've got something for everyone. Pretty cool, right? Check out their products at biomedrxsupplements.com.
Medial sternal to the iris. Excuse me. BiomedRx, may I help you? Yeah, who's calling? Hey, how's it going? Oh, you did? Okay. For 5, yes. I'm sorry about that. I'm sorry. It totally slipped my mind. Okay, I'm gonna draw up. Let me look for your email. Here.
I sent it Thursday at like 1:53.
Okay, Thursday. Matthew J. Bond. Yes, I'm sorry, man. I'm going to reply to this and prepare your quote right now and send it off to you. Hopefully, okay. Hopefully, I can get out there by Friday. I'm not very far from you. All right. Thanks a lot. Perfect.
Yeah, it's just those flies.
I know, right?
Yeah, you might want to scratch them. Where they think right there or something. Oh, wow.
Okay. So, mediasternal and iris. Yeah, sorry about that, son. Mediasternal, and I'm gonna put a small one on your iris.
My nose.
Sorry about that.
Stop. Can you close the door, Dad?
Okay.
Why do all these flies keep?
I don't know why today. Something must be happening in the parking lot that stinks.
Yeah.
That's drawing flies. We may have to cut this short today.
Yeah.
Let me close the door. the inguinal nerve to the inguinal nerve. Parietal to parietal. Okay, it's all right. We're almost done.
Yeah.
We're almost done. Right kidney to the renal capsule on the left has already been addressed. It's redundant. That's why I'm sitting down.
Yeah.
Renal superior to inferior kidney, superior, inferior, it's already been done. Renal capsule and superior, as I've already explained. Vesicular to vesicular has been addressed with the kidneys, with the liver. Suprahepatico, suprahepatico. Go right ahead, son. Okay. Thymus, liver, already addressed. Thymus suprarenal, already addressed.
Yeah.
Thymus to thymus, already addressed. Thymus rectum was the first thing that we addressed. Thyroids to thyroids. See, when we're dealing with the thyroids, we can take the two teardrop magnets and we can attach them to each other like this. trochanter menor, we've addressed that when we addressed the abductors.
Yeah. Also, I think I have to scratch my face, so.
Scratch your thing, man.
So all the magnets were.
Vesicular and vesicular, already addressed. So, scratch my son's face.
Yeah, it's just almost flies.
I know. So, there you have it. These are the pairs for human immunodeficiency virus. As I always recommend, drink a lot of water before and after having biomagnetic pair therapy done. If you are the practitioner, you should also be very well hydrated. At this distance from the equator, we're going to leave the magnets in place for about 30 to 35 minutes. And if we were further from the equator up in Canada, it would take longer. And if we were closer to the equator down in Mexico, it would not take as long. So I hope you guys understand what's going on here. This is not a cure. I am not telling you that you can get rid of HIV with magnets. However, biomagnetic pair therapy will help you augment your present treatment plan. All right? And if you like what you see here on BiomedRx TV, like I said, hit us up, super chat us, super like, whatever. Hit us up on, Cash App. Hit us up on Cash App, $ BiomedRx, and hit us up on Patreon, patreon.com/BiomedRx TV, or you can go to patreon.com/Devin Lockett, or you can go to patreon.com.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate free, gluten free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
Alrighty. Right on time for that commercial. So I hope you guys enjoyed this show. We're going to go and do a little exercise time, a little PT, as well as get some lunch on. Or maybe we'll get some lunch on and then do some PT. But I got to see if I can convince my son to come out after having some fried chicken and doing some bodybuilding with me. But stranger things have happened. We've done our workout on the full stomach before. So anyway, I want you to stay kind as always, because you know kind is the only sexy. It's not just the new sexy. It's the only sexy. I want you to stay blessed and stay healthy. Thank you once again for watching BiomedRx TV. Like I said, if you like the programming that you see, give us a little bit of support. Every little bit helps. $ BiomedRx on the Cash App. You can hit us up with the super chat below. We are now monetized. And so you can super chat, super like us, all of that stuff. All right. You can also join us on Patreon, patreon.com/BiomedRx TV, and patreon.com/Devin Lockett. Anyway, stay kind, stay blessed, stay healthy, and stay HIV free. All right. I love you, and I will see you on the next live. Peace.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate free, gluten free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com